3, 2, 1.
Hi, I'm Hannah Waukee. I'm the physician assistant student. I'm going to be doing a neurologic exam on you today, so please remove your shirt, socks, and shoes, and I'm going to go wash my hands. I would perform a mental status exam at this time. So I'm going to test your nasal patency, so please occlude one nostril and breathe in, and then the other one. Very good, close your eyes. I will be testing the patient's sense of smell, which is cranial nerve 1, the olfactory, so please occlude one nostril. And can you tell me what this is?
Coffee.
Good. And what this is?
Cinnamon.
Very good. Okay, you can open your eyes now. I will be assessing cranial nerve 2, the optic nerve, with near visual acuity. Okay, so can you please cover up your left eye or the right eye? You can start. Okay, and read. I got it. Read the lowest line possible.
937826.
Okay, now switch. Thank you for trying to help.
937826.
Okay, thank you. And both hands down.
937826.
Very good. I would also test distant acuity, visual acuity, excuse me, using the Snellen chart at 20 feet away. So now I will test your visual field with growth confrontation, which will also be testing cranial nerve 2, the optic nerve. So please hold your hands like this and then point when you see my hands come into your line of vision on the side, but look straight behind me.
Okay.
Very good. Very good. Very good. Okay, I will now be checking your pupillary reaction to light, both direct and consensual, which will be testing cranial nerve 2 and cranial nerve 3, the ocular motor. So look straight behind me. Very good. I will now be assessing and testing your accommodation, which will be testing cranial nerves 2 and 3, and your convergence, which will be testing cranial nerves 3 and 4, which is trochlear. Okay, so please look straight behind me, and then look at the pen light when it comes into your vision. Very good, and now look at the tip of your pen light as it comes towards you. Very good. Okay, I will now be testing the extraocular movements, which will be testing cranial nerve 3, 4, and 6, which is abducens. So please look at the tip of my pen light and don't turn your head, just move your eyes. I'm looking for, very good, I'm looking for nystagmus. Very good. Very good. Very good. Very good. Okay. Okay. I am assessing the corneal light reflex for symmetry. Okay. Okay. I'm looking for the red reflex. Okay. Very good. I'm assessing the optic disc and its margins, the cup to disc ratio, the retinal arteries and veins, and the condition of the retina. Look into the light, and I am assessing the fovea and the macula. Very good. Okay, looking for the red reflex again. Very good. Okay, very good. Okay. Very good. So, next I will be testing the corneal blink reflex, which will be testing the cranial nerve 5, which is trigeminal, and cranial nerve 7, which is facial. Very good. And then I'll have you clamp down on your teeth. This will be testing cranial nerve 5 trigeminal, and I'm palpating the masseters and the temporalis. Very good. You can stop. Next, I will be testing the branches of the trigeminal nerve, which is cranial nerve 5. So does this feel the same as this?
Yes.
Does that feel the same as that?
Yes.
Does that feel the same as that?
Yes.
Okay, next I will be testing cranial nerve 7, the facial nerve. So I'll have you close your eyes and don't let me open them. Very good. Okay, and next I will be also testing cranial nerve 7, the facial nerve, by having you do various facial movements. So please raise your eyebrows, frown, show your teeth, smile, puff out your cheeks, purse your lips. Sorry, you got fuzz on you.
Thank you.
And whistle. Very good. Next I will be testing the vestibular cochlear nerve, which is cranial nerve 8. I'll be doing the whisper test, so please tell me what word you hear. Baseball.
Baseball.
Very good.
Football.
Very good. Okay. Next I will be testing the gag reflex bilaterally, which will be testing cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus. So, please open your mouth. Okay. Very good. Then I will have you say ah. Okay, I am noting the lift of the upper palate and also the quality of your voice, which will be testing cranial nerve 9, 10, and 12, which is the hypoglossal nerve. And next I'll be testing the accessory nerve, so please push up against me. Very good, and then turn your face towards me. Yep, good with rotation, very good. Okay, and next I will be, open up your tongue again, I will be looking at the symmetry, position, strength, and right and left movements of the tongue, which will be testing hypoglossal, which is cranial nerve 12. So then I'm going to have you put your tongue in your cheek and don't let me push it in. Very good, now the other cheek, very good. And then I will test the patient's lingual speech by having them repeat the phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Which will be testing cranial nerve 12, the hypoglossal. Very good. I am noting the upper extremities I'm inspecting the upper extremities, for muscular bulge and noting if there is bulk and noting if there's any atrophy. I'm inspecting the lower extremities for muscular bulk and noting any atrophy. Very good. Okay. Now I'm examining the muscular tone. Very good. Okay. Very good. Very good. Very good. Of both the upper and lower extremities. Very good. Okay, now I'll be testing your muscular strength, so I'm going to have you push against me. So in shoulder abduction, which is abduction is what I'm saying, C5, C6, so push up like this. Very good. Then shoulder adduction, AD, will be C6, so push in. Very good. Then we'll have you do elbow flexion, which will be C5, C6, so pull up against me. Very good. Then elbow extension, which will be C6, C7, C8. Very good. And we'll do wrist extension, which will also be C6, C7, C8, so push against me. Okay, wrist flexion will be C7, C8, so push up against me. Very good. Then we'll do hand grip strength, which will be C7, C8, T1. So I'm going to have you go like this, and I'm going to pull it away. Very good. Then I'll do finger abduction, abduction, which will be C8, T1 ulnar. So go ahead and spread your fingers out. Very good. And then I'll have you go like this, which is thumb opposition, which is C8, T1 median nerve, and I'm going to pull against it. Very good. Okay, so next we'll do hip flexion, which will be L2, L3, L4, so lift up your thighs. There you go, then the other one. Very good. Hip adduction, adduction, which will be L2, L3, L4. Very good. And then I'll have you do hip abduction or abduction, which will be L4, L5, S1. And I'm not sure if I misspoke, but on hip flexion it was L2, L3, L4. Okay. Hip extension, so I'll have you push back down against me, which would be L5, S1. Very good. Then I'll have you kick out your knees for knee extension, which will be L2, L3, L4. And the other one. Very good. Then knee flexion, which will be L4, L5, S1, S2. So pull back against me. Very good. Dorsiflexion, which will be L4, L5. So push up your feet against me. Very good. That's good. Thank you. Then I'll do plantar flexion, so push down against me, which will be S1. Very good. And I'll do extension of the great toe, so push your toe up against me, which will be L5. Very good. Now I'll have you close your eyes for the next part of the examination. And I'll have you keep your arms like this for me, please. Thank you. So I'll be testing the anterior lateral aspect of the arm for C5. Does this feel the same as that?
Yes.
Okay, then C6 is lateral aspect of the wrist and thumb. Does this feel the same as this?
Yes.
Then C7, which is the middle finger, does this feel the same as this?
Yes.
C8, which is the ring finger and pinky, does this feel the same as this?
Yes.
And T1, which is the medial aspect, does of the forearm, does this feel the same as this?
Yes.
Okay. And then T4, which is the nipple line, does this feel the same as that?
Yes.
T10, umbilicus, does this feel the same as this?
Yes.
Okay. Very good. L2, which is the inguinal, does this feel the same as this?
Yes.
Okay, L3 is the anterior medial aspect of the thighs. Does this feel the same as this?
Yes.
Okay. L4, does this feel the same as this?
Yes.
Okay. And I went from the lateral aspect of the thigh, across the knee, to the medial aspect of the lower leg. Then L5, I'll go lateral aspect of the lower leg, cross the foot to the great toe. Does this feel the same as this?
Yes.
And S1, which will be the lateral aspect of the foot, does this feel the same as this?
Yes.
Very good. Okay. So, if you want to come closer, I'll be testing position sense. So after I finish moving your hand, you can actually keep it like this. Please tell me if the finger's pointing up or down.
Okay. Down.
Very good. Sorry.
Up.
Very good.
Down.
Very good.
Down.
Thank you. Very good. So next I want you to tell me if you feel vibration or just pressure.
Vibrations.
Very good.
Vibrations.
Very good.
Vibrations.
Okay.
Vibrations.
Thank you. Very good. Okay. So while keeping your eyes closed, can you tell me what this is? This is, go ahead.
A paperclip.
That is correct. And can you tell me what this is?
A pen.
Very good. That was stereognosis. And next I will have you tell me what number I'm drawing, which is graphesthesia.
0. Oh, sorry, 9.
Yeah, very good.
2.
Very good. Okay. So next I will test your reflexes, so you can open your eyes now. Very good. I will be assessing. I'm not sure if you can see from there. Okay. So I'm going to be assessing your biceps reflex, which will be C5, C6. Flex for a second. Okay, then relax. Oh, I felt it move actually. Okay, then the brachioradialis, so just relax. Which will also be C5, C6, and I'm going to do the biceps and the brachioradialis on the other side next. Very good. Okay, now the bicep over here, just relax. Okay, can you clench your teeth for me? Thank you. Very good. That was the bicipital, and then again brachioradialis. Very good. You okay?
Yeah, I felt that one.
Okay. Then we're going to be doing the triceps, which is C6, C7. So just relax. Good. Then triceps again. That's good. Okay. Very good. So now I'm going to have you lay down on the bed, please. I will be testing the abdominal reflex. Okay, so above the Umbilicus, it'll be T8, T9, and T10, and below will be T10, T11, and T12. So, very good. Very good. Okay, and I'll have you come back and sit on the chair, please. Okay, I will be testing the patellar reflex, which will be L2, L3, and L4. Thank you. Very good. Then I will be testing the Achilles reflex with the foot slightly dorsiflexed. Very good. Just relax for a second. This will be testing S1. Very good. Just relax. Hold your hands like this and try to pull your fingers apart. Very good. Very good. Okay. And I will be testing the plantar reflex, which will be L5 and S1. Very good. Very good. Okay. So, next I will be testing your, go ahead, cerebellar functioning. So please touch your nose and then touch my finger. Okay, keep doing it. Very close. There you go. Okay. And then I'm going to keep my finger here, so touch it a couple times to your nose. Okay, now close your eyes. Very good. Okay, so now I want you to slide your, slide your ankle, your heel, from your ankle to your knee and back down. Very good. And then the other side. Very good, back down. Okay, so now I'm going to be testing your rapid alternating movement. So what I want you to do is like you're screwing in a light bulb, so like this. Very good. Okay, that's good. And I want you to go like this. Very good. And then I want you to tap your feet as fast as you can. Like keep your heels on the ground. There you go. Very good. Just like that. Okay, now I'll have you stand up. Okay, move those out of the way. You can face the camera. Okay, and then I want you to stand with your hands out in front of you, eyes open. I'm testing stance, the Romberg test, pronator drift, and muscular movement of the upper extremities. So please close your eyes. Very good. Okay, and keep your eyes closed. Just like let it come back up if it can. There you go. Try to resist me. There you go. Sorry, I didn't say it properly. Okay, you can open up your eyes now. And I want you to walk to the door and back to me, but you can put your arms back down. I'm assessing your gait, so please walk to the door and back. Okay, turn around, walk back. Very good. Now I want you to walk with your heel to toe like a balancing act, I guess. There you go. Very good. And when you get there, you can just pause for a second. And I want you to walk back on your heels.
Backwards?
No, like look at me, like this.
Okay.
Very good. And then when you get back here, I want you to walk on your toes. Okay. Oh, don't hit your head. Okay, just stay right there. And then hop on one foot. Okay, be careful. Then on the other foot. Very good, and both feet. Thank you very much.